Hi, my name is Victoria Howard, and I'm going to be performing oral care on a conscious patient with dentures. So the first thing I'm going to do is hand hygiene. And then I'm going to apply clean gloves. And since this patient has dentures, if I were to remove them, I would gently rock them back and forth to break the seal and carefully place them in the sink and perform oral care on the dentures. But I'm going to assume that I've already done that. So the first thing I'm going to do is I'm going to put my patient in a supine elevated position. High Fowler's is recommended when I do oral hygiene. And then I'm going to place a towel under the patient's neck. And then I'm going to take my toothbrush. I'm going to take my toothbrush and I'm going to apply some toothpaste over the emesis basin on the toothbrush. Then holding the emesis basin close to the patient's mouth, I'm going to pour a little bit of water on the toothbrush, and then I'm going to hold the toothbrush at a 45-degree angle to the gum line, and then I'm going to brush the upper and lower teeth from gum to crown. And if I was doing that on his dentures, it would look like this. And then the next thing I'm going to do is I'm going to clean the biting surfaces of the teeth with a back and forth motion. And then I'm going to brush the sides of the teeth with the bristles back and forth.
For 2 to 3 minutes.
And then, after I've completed that, I'm going to have the patient or myself brush the tongue very gently, avoiding the gag reflex. And then I would give my patient some water so he could rinse thoroughly. And then I would also floss and rinse. And then, after that, I could also, if I needed to, apply some of this moisturizing cream to the patient's mouth. Usually when somebody's unconscious, you could do this just to keep the oral mucosa nice and moist. The next thing I'm going to do after I've allowed the patient to floss and rinse is I'm going to remove my soiled gloves. And perform hand hygiene. And if I did have soil materials, I would also put on a fresh pair of gloves and pick up those materials, then take those gloves off and perform head hygiene again. And that is it for my video.